Hi everyone. Today we're going to talk about minor discomforts of pregnancy. As your body begins to change radically and getting used to being pregnant quickly, minor discomforts also begin. And probably the most common discomfort is morning sickness. I have already dedicated a whole video about it, so please take the time to watch it, especially if you're experiencing symptoms of morning sickness. So let's take a look at other discomforts. For instance, constipation. Constipation is caused by the hormones of pregnancy that relax the smooth muscles of the digestive tract, and the pressure the baby puts on your intestines. And in some women, the iron supplements they take. So let's take a look at things that you can do to improve the symptoms. The best way to ward off constipation is by increasing your consumption of fiber-rich foods, including bran cereals, whole grains, raw fruits and vegetables, and by getting adequate amounts of fruits. Hemorrhoids. Hemorrhoids sometimes occur during pregnancy, but usually they will disappear after the birth. So let's take a look at how you could prevent them. Hemorrhoids are preventable by adding bran to the diet to ensure the regular passage of stools without adding strain to them. Heartburn. What about heartburn? Heartburn is very common during middle to late pregnancy. So let's take a look at some of the natural remedies that women have been used for many years to improve the symptoms. Peppermint tea or alfalfa tablets taken after each meal often help a lot. A natural relief for heartburn comes from the sea, an extract of the seaweed kelp called algae. Avoid greasy food. What about tiredness? You know how you feel tired, especially at the beginning? Well, you are likely to feel tired during the first couple months, but usually after the third month, you should feel more energetic. What can you do? Let's take a look. Plenty of rest, have your iron level checked just in case its level is low, especially hematocrit level. The cause of hematocrit decrease is anemia. What about backaches? Backaches are caused by the increased pressure and the growing of your belly. So let's take a look at some tips, some recommendations that you can do about this discomfort. Sleep on a firm mattress, apply heat, don't wear high heels, walk a lot, stand straight and tall, stick your breast out, don't lean all your weight out with your stomach, exercise pelvic floor. So if you saw the picture, it is the picture of a pelvic floor exercise that you can do. So now let's take a look at varicose veins. Varicose veins are more common after the first pregnancy or if you are oversized. So let's see some of the recommendations, some of the tips that you can do about this discomfort. Do not sit or stand for long periods of time because gravity puts more pressure on the veins. Don't wear biting clothes and elevate your legs often. Don't sit with your legs crossed at the knee. It puts direct pressure on major veins. When sit, elevate your legs above the level of your hips. If a swollen vein is red or tender, see a doctor. Also, vitamin E can help varicose veins, but as always, I suggest that you check with your healthcare provider about it or your nutritionist if you have one. Exercise too and control your weight is as important as the rest of the suggestions, recommendation. So let's take a look at leg cramps. Leg cramps are usually caused by poor circulation. So let's take a look at some of the tips again, some of the suggestions that you can do to improve that discomfort. Rub out your legs often and squeeze your feet. Don't cross your legs when you sit, and be aware that lack of calcium may cause leg cramps. So you might want to increase the amount by half. Lack of B vitamins, support hose might give you relief. So again, lack of calcium, lack of B vitamins, but this is something that you need to check with your doctor or your midwife or even a nutritionist if you have one. Now, last but not least, and obviously not all of them are listed, there are many other, but I have tried to mention the most common ones. So let's take a look at swelling of the ankle and feet. Usually during pregnancy, the extra fluid in the body and the pressure of your uterus, your growing uterus, caused swelling of the ankles and feet, or it's also called edema. So usually the swelling of the ankles and feet is not a cause for concern, and the condition or the symptoms usually are worse at the end of the pregnancy when a woman's due date is near, and by then at the end of each day and during hotter weather. So what are some of the tips, suggestions, recommendations that you can do to improve the symptoms? Let's take a look. Avoid standing for long periods. Prop up your feet when sitting and avoid crossing your legs. Stretch often when sitting for long periods. Lie on your left side when sleeping. Drink plenty of water. It may sound odd, but if your body feels it is dehydrated, it will try to retain even more fluid. Swim or stand in a pool up to your neck. Exercise regularly. So I hope that you have found this video informative. I hope that you enjoy it. So please take care of yourself, exercise regularly, control your weight. There are simple things that you can do to improve these minor discomforts of pregnancy, but that can sometimes deprive you of your sleep and therefore of your energy, and make you feel miserable. So I hope you can find it useful. I hope that you like it. If you like it, please don't forget to press the like button. If you would like to start following me, please don't forget to subscribe and activate the bell notification button as well, so that you can know every time that I upload a video. Please do not forget to leave your comments. If you have a question, concern, doubt, please leave it in your comments, and I will see if I can dedicate a video, about that question, that concern, that doubt. Until next time, please take good care of yourself. Bye now.